There are a number of reasons why you may be considering a tummy tuck, and that may be because of an overhang of skin. It may be due to a separation of the tummy wall muscles, a sensation of bloating, or the shape of your tummy. And often they are related to certain life events, such as having had babies, weight loss, or perhaps part of the aging process. There's no right or wrong reason why you may be thinking about having a tummy tuck, but as long as a tummy tuck can deliver and solve the problems and get you to achieve the goals that you're hoping to, it can be the right procedure for you. Broadly speaking, there are three factors that will contribute to someone's shape, perhaps after pregnancy, let's say, that may stimulate them to think about a tummy tuck. The first is there may be some excess skin with some excess fat causing an overhang, or just some muffin top that spills over the top of jeans or clothing. The second is a separation of the tummy wall muscles, which can lead to bloating and can lead to a weakness of the tummy. And sometimes people get some increased backache and lack of strength from that. And the final thing is that in addition to those, because of a stretching of the tummy wall, particularly with pregnancy or perhaps being overweight, the actual capacity of the tissues to hold in the shape of the tummy is reduced. So people tend to have a fuller appearing tummy that bloats more easily and is less sturdy than their pre-pregnancy or pre-weight gain situation. And all of those can be improved with a tummy tuck. So I perform my tummy tucks without using drains, so-called drainless or no-drain tummy tucks. And the reason these procedures have been developed is to increase patient comfort, reduce the problems and risks of drains, and certainly to reduce the discomfort of drains, because they're very uncomfortable, particularly to have taken out. And the reason we can do tummy tucks now without using drains and without worrying about the fluid collections that people used to worry about is by changing and adapting the surgical technique. So my actual technique of doing surgery and what I do on the inside is very different to how it was, let's say, when I was first trained to do tummy tucks. By leaving certain layers of the body, certain layers of fat and lymphatics, importantly, we can allow the body to absorb the fluid that may otherwise build up, which means we don't then need to have drains because there isn't that build-up of fluid that used to be needed to be removed. Liposuction is something I do with about half the tummy tucks I do, and that really is principally targeted at the flanks and that waist area to really enhance the shape, because the tummy tuck is going to address the front of the tummy, but it's not on the whole going to address the sides. So to improve the overall contour, in many people it can be quite useful to be able to use liposuction. What I'd often say is that a tummy tuck on its own will give a lot of people a good result. Tummy tuck with liposuction will give people a better result. So you can take a view after your examination and after our discussion as to whether it's the right thing for you. And there is no right or wrong about this, but I certainly think that for a good proportion of people, liposuction can really add to the result. Scars for a tummy tuck include the main scar, which is a curved scar that sits in the bikini line. And I certainly do my very best every time to place that scar as low as possible. So it's hidden wearing underwear and hidden wearing bikinis, swimwear, and other similar types of clothing. There's also a scar around the belly button, because the belly button needs to be popped through the skin once it's brought down, a bit like a button popping through a buttonhole, to enable that belly button to be repositioned in the correct place. So there's a main scar at the bottom, and then there's a scar around the belly button. So during tummy tuck surgery, the incision is made that I've pre-planned and marked beforehand. I don't actually take the whole amount of skin I've estimated off, because I want to check that's been the right amount to have planned, which I can only do later on in the operation. So once the tummy skin and fat is lifted up off the muscle wall, it's carried on to be lifted up all the way up to the bottom of the rib cage. That exposes a gap between the muscles, or the muscle layer. I can then stitch that muscle layer back together, which is really stitching what's called the fascia rather than the muscles themselves. So that's a tough layer that's on top of the muscles. Once that is done, we bend you so you're sitting in a jackknife position, asleep on the operating table. And that will allow me then to estimate how much skin and fat I can remove. Only then do I remove that, and then I can stitch you up and place the belly button through a new opening, creating that scar around the belly button. So a mini tummy tuck is known as a mini tummy tuck, not because of a small scar, because actually often the scar is very similar length to a full tummy tuck, but because there is no muscle repair, And it's a smaller operation overall because it is really dealing with just excising the lower part of the tummy. If we excise too much, we risk pulling the belly button down into a slightly strange, abnormal place. So we're thinking about what we need to leave behind to ensure that we don't distort your normal anatomy. So therefore, a mini tummy tuck is only suitable for people with a very small amount of skin excess, ideally for people who don't need anything in the way of tummy muscle tightening. So we can deal effectively with what may be a slight overhang, perhaps a bulge over a cesarean or appendix scar, or perhaps just a little bit of laxity in the lower part of the abdomen, because it won't have a bearing on any other part of the abdomen apart from the lower part of the abdomen. As a rule, recovery after full tummy tuck surgery I'd think about as a 6-week block. For the first 2 weeks, you'll be needing to take it very easy. You'll have reduced mobility, but you will still be mobile, although you'll be walking slightly bent over. By 2 weeks, you should be straight, and we would make sure you're straight if you're not feeling comfortable getting straight on your own. And then by 6 weeks, you should be able to do most things you'd like to do with respect to starting to get back to exercise, going swimming, that sort of thing. So between that 2-week and 6-week period, that 4-week period is a time of gradual build-up, increasing exercise within the limits of comfort, increasing movement, but not overdoing it, no heavy lifting. And please bear that in mind if you've got young children, getting into car seats, being lifted up if they're on the ground. So you've really got to have logistics and considerations on that front in hand before proceeding with the surgery. Tummy tuck, like any other surgical procedure, will have risks associated with it. We consider risks to be things such as bleeding or infection. If bleeding occurs, we might need to go back to the operating theatre to stop it. Infection might need antibiotics, or sometimes even going back to the operating theatre. It's not uncommon to have small areas of wound inflammation, or even what we call stitch spitting, where stitches work their way out of their wound and they need to be just dealt with in the clinic. Sometimes you may need dressings to dress any part of the wound that's slightly delayed in healing. The scars usually settle down very well, but sometimes they can be lumpy or thickened, which might need further treatment. There can be fluid buildup known as seroma that needs to be drawn off. And the other consideration is that whilst we try and make everything as symmetrical, particularly with the scar, as possible, inevitably there will be some differences between left and right halves of the scar. The swelling after a tummy tuck takes some time to go down. Most of the swelling is gone by about 6 weeks, but for several months after that, there will still be some swelling, and that particularly sits in the lower tummy. And the reason for that is that tummy tuck scar across the bottom of the tummy acts a bit like a dam in a river. So it effectively stops that swelling from dissipating, from draining out through lymphatic channels to the lymph nodes, which it needs to do. And it takes some months for the scar to soften to allow new lymphatic channels to grow through, which is what they need to do to drain that fluid off. So inevitably in the mornings when you've been lying flat, or even a couple of months, maybe 3 or 4 months after surgery, you'll feel your shape is a lot better than in the evening after you've been standing up all day, because the lymphatics will need that time to grow through for you to get that morning shape all the time. After tummy tuck surgery, once everything's healed and once you're able to get back to exercising again, the most important of all exercises, in my opinion, is core muscle exercises. And I think there probably is no better way of exercising your core than doing Pilates. And the idea is not to focus on the six-pack, the rectus muscles at the front, but to focus on the obliques and transversus muscles, the muscles that are going to help maintain your core shape and improve your overall posture and position. And actually these will help with any backache, back pain, or other back issues that you may have. And that will enable you to maintain your post-tummy tuck result for the longest possible period of time.